So the first test we're going to talk about, and I'll pull Emily up here in a minute if she doesn't mind. You're so gracious. I appreciate it. We have an adduction drop test. What this test is a reflective of a bony osseous test. Remember in your left AIC pattern patient, when the pelvis is coming forward, I told you how Emily has to actively abduct and externally rotate her femur. So if you're laying your patients on their side, their femoral head is going to hit on their acetabulum so the leg can't come down. That's going to solidify to you that their pelvis is forward. In a left AIC pattern, I'm going to demonstrate this in a minute. In a left AIC pattern, which side is our inlet forward on? The left side. So the adduction drop test is going to be positive on the left side. With your PEC and your patho-PEC pattern patients, the pelvis is forward on both sides. So the adduction drop test is going to be positive on both sides. Okay? The next test I'm going to demonstrate, I'm going to go through 3 of them, and then I'm going to pull Emily up here and demonstrate them. The next test, we have a standing reach test. And with the standing reach test, this is the ability for someone to bend down and touch their toes. In this test, I'm going to do it from my right side. If my right side can go back, and I have my feet shoulder width apart, and I bend down and take my hands over to my right side of my foot, my fingers should be able to barely touch the floor. And if my inlet can go back, it's going to allow me to touch the floor on my right side. But if I have a left AIC pattern patient where my pelvis is coming forward and my back is arched, it should be hard for me to touch the floor, particularly on the left side. Sometimes your patients can bend all the way down, and I would like that if their adduction drop test was what? Negative. But if their adduction drop test is positive, then we know the position of our inlet and our outlet, and we know that they're going more into our lordosis, they shouldn't be able to touch their toes with that inlet position. So sometimes this test can be negative that they can touch their toes when they shouldn't be able to. So now they've stretched out a hamstring. They've stretched out a back. Something's allowing them to touch the floor. In your PEC pattern patient, if the pelvis is coming forward on both sides and they have a lordosis, they should not be able to touch the floor on either side. That's going to be tight. And we would expect that if they have a positive adduction drop test on both sides. But remember, your patho-PEC pattern patient, they stretch through soft tissue. So in those individuals, they're still going to have an adduction drop test that's positive, but they're going to be able to, in some instances, palm the floor. This test is going to differentiate between a PEC and a patho-PEC pattern patient. If you have a patho-PEC and they can palm the floor, John, like your runner, and they have an adduction drop test that's positive on both sides, that's pathology. The next test I want to go through is your pelvic ascension drop test. This test, you guys, is an active test. It's like doing the adduction drop test, and I'm going to show you this more passive. The tester is taking that patient back and helping to see if that left leg can come down and hit the table. With the pelvic ascension drop test, your patient has to be able to actively bring, they're going to pick up their left leg, they're going to come back, and can their left knee come down and hit the table? The adduction drop test, you guys, is about taking your left inlet from being forward to being able to come back to a neutral position. And with the pelvic ascension drop test, they've got to be able to take their innominate bone and go what? Back. Because if I can get all the way back into left stance, I have to have abduction and adduction control of an innominate bone. So if I flip my pelvis over on its side, and if Janie in the picture has to be able to actively adduct her femur, she's got to be able to actively abduct an outlet against gravity. And if I can abduct my outlet against gravity, I can adduct my inlet. So this test is going to tell you if you have a patient that has a negative adduction drop test, and then you go and do this test, and their left leg cannot come down and hit the table, you know you have a pelvis restoration patient, and you're going to follow that algorithm of treatment. If you have a patient that their adduction drop test goes negative, and this test is also negative, that is a mild kinematic restoration patient. That's another 2-day course, and that is a different algorithm of treatment.